This episode is sponsored by Grow Therapy. Grow Therapy was founded on the belief that quality mental health care should be accessible. It makes finding an in-network therapist easy. Go to growtherapy.com to find your match and let insurance pay for your therapy.
Welcome to a place where you'll leave feeling whole. The Counseling Podcast brings at-home counseling right to you, focusing on self-care, self-expression, and breaking down barriers. Dr. Jacqueline and Dr. Stokes bring over 20 years of combined experience and a new sense of style to the word counseling. The two use humor and lighthearted conversation to explore these deeper feelings. Let's take the stigma away from counseling together.
On the Counseling Podcast, we have another special guest with us today speaking about post-COVID depression and anxiety. Hello, Dr. Caroline Tomlinson. Please introduce
Hello.
yourself to our listeners and where they can find you.
Hi, my name is Dr. Caroline Tomlinson, and I am a psychiatric mental health nurse practitioner based out of DFW area, Arlington, Texas. You can find me, my website is www.kempsyc.com or Kemunto Psychiatric Solutions LLC if you Google it. Office wise, located on 1301 South Bowen Road, Suite 470 in Arlington, Texas.
Perfect. And we're going to speak about post depression and anxiety after COVID. And so tell us about what you've been learning about and what you've been sharing with your own clients in practice.
Sure. So I noticed that, a lot of people mainly focus when they hear COVID. What's the first thing that comes to mind? They think about shortness of breath, breathing, just respiratory problems. But I've noticed, there's a huge concern about mental health and how people's mental health have been affected. Because if we remember, a lot of people lost their jobs during COVID. A lot of people had businesses that were thriving and they just went to zero. So there've been a lot of struggles financially that have led to depression and anxiety, even for those who never suffered from COVID. But if you look at the population that suffered from COVID, it's interesting because some studies reveal that a third of these patients have suffered from what is called brain fog. You'll hear patients telling me sometimes, since I recovered from COVID, I'm confused most of the times. I have this brain fog. I can't remember. And just because of that alone makes them feel depressed. It makes them feel anxious because they cannot perform to the level they were before this affected them. So I've seen a lot of people suffer from that. They'll tell you that either they have headaches that don't seem to go away, they come and go, or they have brain fog and confusion. And some of these patients are in their 30s, 40s, so it's not like they have dementia or anything. They just suffered from COVID, and these are some of the after effects.
And all of that really can affect your everyday, daily routine. Because if you're
Yes.
having trouble with just doing what you normally did, it can bring on probably extra anxiety or a depressed mood because you're like, I'm not feeling the way I used to. I can't function at the same level. And
Yeah,
something that's medical can definitely impact your mental as well.
exactly. Exactly.
Yeah, and so when patients come in to see you with this presenting issue, Dr. Thompson, how do you approach that if you know that it's maybe because I guess there's no way to know for certain if it's necessarily COVID related, but I'm sure there's many instances and cases where there's probably a high correlation. How do you go about approaching that and treating that condition, brain fog, and things of that nature?
Okay. So usually if a patient comes to me and they complain about, okay, I'm having this brain fog, I can't think, or my memory has been affected. So part of my screening will be, during COVID, did you contract COVID? And, go through the whole screening tools use my PHQ-9 and GAD-7 just to see where they fall on the scale. So if it's something related to um, where they're having severe headaches and it's really impacting part of their life, then usually I refer them to go get a CAT scan or a MRI to see just how bad it is. And if it's mild cases where they're just telling me, okay, I'm really starting to have panic attacks because I can't function. So the first thing I usually do is usually refer them to therapy because, some patients don't just like taking medication. And for me too, sometimes I feel if therapy can help, why medication first? So I'd refer them to therapy first. And if they feel that, okay, I've tried therapy for a while now, I'm still not coping, then now maybe I can suggest, a low dose antidepressant or a low dose anti-anxiety to help them during these times.
I think that's so important. I like how you really go to the biological basis first with getting a brain scan to figure out, hey, is there something that perhaps we can see, but then also
Yes.
trying the psychotherapeutic approach after that to try to
Yes.
avoid medication if possible, and then being able to come in and utilize medication if necessary. So it sounds like you have a whole process that you utilize with these patients.
Yes.
And is there a specific age you're seeing this particularly with, or is it, kind of all a big range?
Um, I think most of the patients I'm actually seeing, these are patients in their 30s and 40s. And you can understand why it's very frustrating for them because these uh, patients that feel like I still have a lot of my life ahead of me and I can't function. Like, this is slowing me down. I've had patients to the point where they can't work. They've gone to someone who used to work and now they're on disability because they can't work, they can't think straight, they can't do simple tasks such as even balancing a checkbook. And it's very frustrating. And as mental health providers, I usually tell some of my colleagues this is where the non-judgmental zone comes in, because a patient is looking up to you for help. And sometimes as providers, you're looking at a patient and thinking, okay, you're still 30 and 40, why can't you do this? you know and when you do that and pass judgment, that's why it interferes with even their growth or trying to heal from what has happened. So 30s and 40s age bracket, that's where I'm mostly seeing it. And then when it comes to the geriatric age, I'm not seeing a lot of it because sometimes it's not a clear cut distinction. Some of them are already suffering from dementia or Alzheimer's. And then when this happens, you can't tell whether did COVID cause this or was this happening prior to you even having COVID. But it's really concerning for those who are in that age bracket because this is when they feel like I'm trying to work and save for my kids or for my family, and now this is trying to set me back.
And as the professional, kind of, we have that responsibility to encourage them to kind of have that self motivation. So kind of, don't let COVID or the symptoms you're having stop you. Of more of, like you're saying, you're
Yes.
in your prime, and maybe we can find ways to help you to kind of get back on track. How
Yes.
do you do that with them? Are there tasks that you do with them?
Yeah, so some of the things, some of the advice I've given these patients is, you know, the first thing I tell them is try to establish a consistent routine. So, for example, if you are someone who woke up in the morning and did yoga, or you meditated, or tried to walk before you started your day, try to put it down on a journal and stay consistent to it. That way, if you feel like, okay, my mind's just telling me to sit down and relax, just try to push yourself. If you used to work, maybe walk 5 miles, maybe try 1 mile first and kind of build up to the 5 miles again, because you're not at that point where you can quickly go back to 5 miles. So just start slowly, be consistent, and then set realistic goals to try to get back where you were. And we start that by just establishing a consistent routine whereby you can get yourself active and do the things that you used to love doing.
And Do you feel like some of the clients are feeling almost alienated from other people because if, COVID, because of it's being new and everything, and if they have it, a lot of maybe other people didn't go through what they went through. So they're feeling like they can't relate to other people or other people can't relate to them. Do you see that of like, I'm feeling isolated, or I don't feel like I can compare myself to other people because they don't know what I'm going through, or they lack that validation?
Yes, I see that a lot. The isolation from COVID itself was bad for everyone. I think you guys can relate to because at that time we were not able to mingle even with our family members. Like holidays, were not as meaningful like before because you were held up in your house alone, and you couldn't go anywhere. So just think about these patients in this context. First, they were isolated, then they contracted COVID. Now they feel like they can't even relate because not everybody suffered from COVID. So they might try to vent their frustration to someone who never got COVID and is not really understanding what they're saying. And I'll give a very good example. One of my very good, one good friends and a colleague as well, she was confiding about having these headaches that have persisted post COVID, had a mild case of it. It wasn't even a severe case. And then, now has these constant headaches, doesn't know what to do, is on medications, they're not helping, so when she tells you that and maybe you've not had it, clearly you won't pretty understand, what she's going through. So they feel very alienated. And most of the times, even when they're talking to professionals, professionals might not understand because maybe they didn't go through it. Or maybe they did and don't have that symptom, you know.
And that's got to be the challenge of this, is that we're still just trying to figure this whole thing out, right? And you mentioned kind of the different symptom presentation in different people and different age brackets, and you made a really valid point about that 30 to 40-year-old bracket of people who are working, their parents often, they've got, sometimes they're taking care of their parents and their children, the sandwich generation, we call it, right? And so there's so much going
Exactly.
on, and it's trying to identify with each patient all of these subjective, unique experiences after this pandemic. I'm sure it's a tough thing to do.
It is. And it's affected the community in a very big way.
Yeah. So just I really like the holistic approach that it sounds like you have, and it also sounds like you have a very tailor fit approach, and that you meet patients where they are specifically. I'm curious, why, and how has that been conducive for you in working with each individual from that unique perspective to meet their own needs versus kind of an umbrella approach?
Yes, the reason why I, use the patient-centered approach because I feel each individual is unique. And I feel like if you have a standard plan of care of how to treat everybody, it's not going to work. Because, for example, you might come to me and you tell me, okay, Dr. Tomlinson, I'm depressed. I can't get out of bed. I can't sleep. I can't eat. I can't think. Okay, so Dr. J might come to me and tell me, hey, I'm depressed, but I'm still functioning. I still can eat, I still can, but maybe I just can't concentrate on my work, you know. So if I treat you both the same way, it's not going to work because I have to look at you from the point of, okay, you can't eat, you can't sleep, you can't think. So I have to find a plan of care that will help you get motivated, be able to eat again, be able to function again. And her plan of care would be, okay, how can I help her? She's still functioning, but she can't concentrate. Now let me help her fix that part so that she can be whole again. So, and it's the same way. You can't treat an adolescent the same way you treat an adult, the same way you treat a geriatric, because our bodies function different. And that's what I tell people. Even when choosing a type of medication, you might react differently to it than Dr. J. For example, Zoloft might make you tired, sleepy, can't think, maybe make you a zombie. But with her, she tells me, "Oh wow, it has lifted my mood. I'm feeling great." So as providers, it's very important to treat each individual uniquely. Meet everyone at their point of needs, know what their primary area of concern is, and then formulate a plan from there.
Yeah. And then absolutely. And then adding in the complexity that everybody kind of went through this pandemic in a different
Yes.
way, right? Everybody, I mean, even though there
Yeah.
was some universal things that we all experienced, the lockdown, the fear, the paranoia about what was going on, but
Hmm.
also we all sort of had our own personal experiences. And so as mental health
Yes.
providers, we've got to be able to identify those specific needs post pandemic as well. Yeah.
Yes. And the thing is, COVID has affected everybody in one way or another. Like others have lost their jobs, but the healthcare industry seemed to do well at that time because they're the only people who could work because they needed healthcare. But then also look on the other side of the coin, healthcare workers are burnt out,
Right.
you know like they're so burnt out. A lot of people have left the field, so COVID has affected. And I was looking at a study that said there was a study especially done on US veterans that was published in BMG that said, having COVID gave you high risk of developing mental illness like a year down the road.
Mm,
So, how accurate is that? I guess that's yet to be found, but we can see the effects are still happening till today. COVID happened like 2 years ago, and this is 2 years later. I think a lot of people are even committing suicide because they just can't deal,
absolutely. Absolutely.
you know.
I'm seeing a
Yeah.
really big, I work with a lot of families and adolescents, and I've seen
Yes.
a huge impact on kids, particularly kids,
Yes.
like kids who maybe their junior and senior year was when this whole thing started, right? So now they're starting
Exactly.
college, having been
Yes.
on lockdown for a year or two, depending on where they're located in the country, and sort of
Yes.
having lost that functioning of that socialization functioning that they were so used to. So I've really
Exactly.
seen it impact our youth in a very
Yes.
specific way.
In a very big way. Yes.
So it sounds like really, you're kind of working on finding people's triggers, what specifically to them is adding to their anxiety, depression, giving them those coping skills,
Hmm.
allowing them to understand, just kind of that find that self-soothing, self-motivation. Is there
Yes.
anything else you think is really important to share?
Yes, yes. I think one other thing that I share with my patients and I can share with the listeners is it's very important to maintain social connections, especially now, because during COVID and the lockdown, everybody suffered from social isolation. Some of the depression and anxiety we see came from that isolation. And now that things are opening back up again, it's very important for people to maintain social connections, whether it's a friend, whether it's a family, whether you're going out of the house just for a few minutes to talk with a friend, walk out with a friend, grab a bite with a friend. It's just important to maintain that connection because remember, when we isolate, that's when we have all these dark thoughts and negative thoughts, and we start thinking, you know, life's not worth it. But, just going out might make you find a reason, to try and get back to your normal routine or try and laugh with friends. Just maintaining that social connection is very good. you know Another thing I'd also tell the listeners is that, any physical, because sometimes people might think, okay, this headache or this physical symptom might go away. If you find it's still not going away, it's bothersome, it's interfering with your life, then please, please, please seek medical attention. Some of the things don't just go away, and when we try to manage by ourselves, we find we run into more challenges, so it should not be, people should not shy off from seeking a medical help, maintaining connections, and then taking precautions. Right now, sometimes I look around and I feel that people think COVID is gone, but it's still there. We might not talk about it right now because there's still a lot of issues going on. So sometimes even just maintaining precautions when you go out to a large crowd, and just still being careful at the end of the day, because COVID is still part of our life.
Absolutely. Yeah. I mean, just because it's not something that is maybe front and center as it was, it doesn't mean that
Yes.
this is all just passed on, right? This is something that we still
Yes.
have to be mindful of. And I think mindful of in terms of safety precautions, but also psychologically. And I love the idea of you mentioning the social piece. I think that's such a big issue, and I've seen that in a lot of my patients as well. And you had mentioned sort of the downtick in social interaction, and I had noted that I really noticed that in kids, but I see that in adults as well. I mean, in fact, I
Mm-hmm.
was working with a family, and they have some loved ones who are still not completely comfortable with family
Yes.
engagements as they were at one point. And so, it's
Yes.
being able to encourage people to reintegrate those things in their life, but in a safe, healthy way is what I'm hearing.
E- Exactly. Exactly.
Well, Dr. Tomlinson, it was an absolute pleasure having you here
Oh, it
today.
was a pleasure. It
Uh,
was a pleasure.
so thank you so much.
Thank you so much. I appreciate you, Dr. Stokes. Thank you.
Thank you so much for joining us here today on the Counseling Podcast with Dr. Jacqueline and Dr. Stokes. Please take this time to thank yourself for putting in the work. If this episode impacted you in any way, let us know with a loving and honest review. If you have any questions or want to continue the conversation from today, you can reach out to us at thecounselingpodcast@gmail.com, and we can answer your questions right here on the show. Or you can find Dr. Jacqueline and Dr. Stokes on Instagram at DocJacqueline and at dr.jeremiah.stokes.